Hello, I'm Dr. Tracy Paschke with Heart Health Prevention and Wellness. We're continuing our series of risk factors for heart disease. I wanted to talk today about diabetes and how it increases cardiovascular risk. About 38 million Americans have diabetes, which is about 1 in 10, and approximately 90 to 95% of them have type 2 diabetes. Type 2 diabetes most often develops in people as adults over 45, but more and more frequently we're seeing diabetes, what we used to call adult onset diabetes. We're seeing it develop in children, teens, and young adults. Insulin is a hormone that's made by your pancreas that acts as a key to let blood sugar or glucose into your body's cells, which they use for energy. If you have type 2 diabetes, your cells don't respond normally to insulin, and this is called insulin resistance. So your pancreas makes more insulin to try to keep up and try to get the cells to respond, but eventually your pancreas can't keep up. Your blood sugar levels rise, and that sets the stage for prediabetes and type 2 diabetes. Diabetes is a significant risk factor for cardiovascular disease, and as we've discussed, cardiovascular disease is the leading cause of mortality globally. So understanding this connection between diabetes, its precursor insulin resistance, and cardiovascular health is crucial for us to be able to implement prevention strategies. So type 2 diabetes affects the body's ability to use insulin effectively. This leads to elevated blood glucose levels, and over time, these high blood glucose levels can damage blood vessels and nerves that control the heart, which increases the risk of cardiovascular disease, such as coronary artery disease, heart attack, stroke, and peripheral arterial disease, so it affects the arteries in the legs. And elevated blood sugar can also affect the brain, the eyes, the kidneys, and other organs. So let's talk a little more about insulin resistance, this precursor to diabetes. So insulin resistance is a condition where the body's cells don't respond effectively to the insulin that the pancreas has secreted, and that's the hormone that regulates blood sugar levels. As a result, the body needs higher amounts of insulin to help the glucose enter the cells. This condition, this insulin resistance, often precedes the development of type 2 diabetes and is closely linked with obesity. Also, it's linked to a sedentary lifestyle and an unhealthy diet. Insulin resistance is also associated with other cardiac risk factors, including high blood pressure, abnormal cholesterol levels, and inflammation. So it creates this complex interplay of factors that increase overall risk for CVD. So what are some strategies to prevent diabetes and reduce our cardiovascular risk? Prevention of diabetes and its associated cardiovascular risk begins with addressing this insulin resistance. So here are several strategies to consider. First, eat a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, which can help manage weight and reduce insulin resistance. Limiting the intake of processed foods, refined carbohydrates, and sugary drinks is also critical. Evidence shows that eating animal products, especially red meat and processed meats, can cause insulin resistance. So aim for a whole food, plant-based diet. Number 2, engage in regular physical activity. Regular physical activity can improve insulin resistance, lower blood glucose levels, and reduce cardiovascular risk. The American Heart Association recommends at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous activity each week and 1 or 2 days of muscle strengthening activities. Number 3, maintain a healthy weight. Excess weight, particularly around the midsection, can increase insulin resistance and the risk of developing diabetes and cardiovascular disease. If you're overweight, losing even a small amount of weight can significantly reduce this risk. Next, monitor your blood sugar levels. For those at risk of diabetes, regular blood sugar level monitoring can detect any early signs of insulin resistance and allow for timely interventions. Your doctor might check your hemoglobin A1C, which measures your average blood glucose levels over the past 2 to 3 months. And now you can get continuous blood glucose monitors. So these are little devices that you put on your arm, and it measures your blood sugar levels throughout the day. And these were recently approved you can obtain them over the counter. You don't need a prescription. And these monitors can let you see how different foods you eat can affect your blood sugar levels. Next, manage stress and prioritize sleep. Chronic stress and inadequate sleep can contribute to insulin resistance and elevate your blood sugar levels. So adopting stress reduction techniques such as meditation, yoga, or deep breathing exercises, and making sure you're getting 7 to 9 hours of good quality sleep every night are essential components of a heart-healthy lifestyle. Next, get regular health checkups. Regular checkups with your doctor can help monitor risk factors for diabetes and cardiovascular disease, including blood pressure, cholesterol levels, and body weight. And early detection and management of these risk factors are crucial to preventing the progression of diabetes and reducing the risk of cardiovascular disease. So in conclusion, diabetes and insulin resistance are significant risk factors for cardiovascular disease, but they're largely preventable through lifestyle modifications. Adopting a whole food plant-based diet, engaging in regular physical activity, maintaining a healthy weight, managing stress, prioritizing sleep, and undergoing regular health checkups can significantly reduce your risk of developing diabetes and its associated cardiovascular complications. Through education and preventive health care, we can work toward a future with lower rates of heart disease and healthier communities. If you need help, reach out to me at www.hearthealth.care, or you can email me at drtracy@hearthealth.care. See you next week.